without your health, how are you able to take care of your kids? Exactly. Without your health, how are you able to get up every day to go to work? Without your health, how are you able to... Your health is the most important thing.
No.
It's your temple. So I feel like when you prioritize your health, everything else comes after that.
Yeah.
But it's very strange that, from lower class backgrounds, most people tend to think that, I'm too busy or I don't have the time to think about my health right now. But without your health, you're nothing.
Yeah.
No,
definitely.
And also sudden death is real. When I hear stories of people dying suddenly, and I'll think to myself, you looked so fit, I couldn't tell you had an health issue or there was a problem. That scares me to book the GP appointment, to be like, I got to make sure everything's under control, if you can get what I mean. Welcome to the Goodman Factory podcast. My name is Rizzy. I'm joined by two special guests today. We're here to talk about men's health. I'm here with
Aleem. I'm a junior doctor with NHS.
And I'm Chris. I'm the co-founder of Coast Juices.
Glad to have you guys on. So today we're going to talk about men's health. We've got Dr. Aleem here. Me and Chris are going to speak to Dr. Aleem and just ask him, a lot of things that tend to be misunderstood within our community when it comes to men's health. I would like to start off by talking about the taboo against men going to visit their GPs. I have a lot of friends who, they don't go for checkups.
Yeah.
I'm sure that's a common problem, probably within the NHS.
Yeah.
Men wait till it's too late to, check to see if everything's fine when it comes to their health. What's been your experiences at the NHS, and what have you learned when it comes to men?
So I think when it comes to men, there's a long-standing issue with young men, particularly having difficulty, we could say, seeking help. So usually there's this air of, let's say, macho-ness, whereby you don't want to come across as vulnerable. So you will wait until your condition is so serious that you need help before seeking. And I don't know, what would you say your experience has been?
So when it comes to me, I've always known the importance of going for checkups. I would say I was a bit ignorant when I was a lot younger.
Yeah.
But I definitely learned something from my pops, who he was just like most men, grew up with positive mindset.
Yeah.
I can take care of myself. I don't need any doctor to tell me about myself. And I'll call it ignorance. I saw the ignorance in my pops, and if life has definitely humbled him. I saw how life humbled him, and presented problems that he couldn't ignore. And when he went for to get seen at the doctors, eventually it was too late. But luckily he was able to solve the problems that he had. I'm not going to go into the details, but it was, I could have potentially lost my dad. So that sparked something within me to cut this ignorance and to ensure that I go for regular checkups. I'll be in my GP appointment and I'll just be like to the doctor, I need to know that my kidneys are working good. I need to know that my liver's working, my lungs, can I do a blood test or go for a checkup? And it does bring a lot of inconvenience to me, because I've got to take time off work and a lot of people, I understand why a lot of people just think I don't have the time to do or go back and forth with the healthcare system. So I just make sure that, I stay on top of my health and I go for regular checkups and I look after myself. What about you, Chris?
So with me, I'm really lucky because my mum, she was a nurse. So from young, it's always been a case of, if I complain about something, she'll be like, you need to get that checked. Do this, do that, do that. So from young, I've always kind of been getting checked. But then, obviously, at the same time, when you're young, as a going into a young man, you feel like oh, you can handle this.
Yeah.
Do this, do that. And obviously with a lot of men as well, unless you're like feeling like you're on your deathbed, you feel like, yeah, I can handle that. That will just pass by. Next week, that'll be good. Do you know what I mean? It's the same thing with like, for example, like with football, when you get an injury, that will just pass. Do you know what I mean? And then next week, you'll be fine. But luckily for me, as I was saying, growing up with a mum that was a nurse, it's always helped me to kind of be on top of my healthcare, any problems that I've had.
Yeah.
Interesting.
But even me personally, being a doctor, I've had situations where I maybe thought, okay, I should get a checkup, and it takes a long time. It takes a lot of effort for me to be like, okay, you know what? I need to take time off work. I need to book the appointment. I need to get certain investigations. And there's that air of invincibility whereby you feel, it's probably nothing. It's probably something that's going to resolve itself. Yeah. And two, it's, can you afford to take time off work? So there's lots of layers to it. If we think of men in general, probably in the lower classes, you don't have the luxury to put your health first. You're thinking, I've got kids to feed, I've got a mortgage to pay, I've got bills to pay. Whatever health condition I have, it's just gonna have to
Fizzle out?
Not fizzle out, but I can't afford to pay attention. And then when it gets to the point whereby you have to pay attention, it may be too late. Yeah. Or you may be in a position where you're not able to I don't know, give it the effort it requires.
Yeah. I think it's very funny that you say that, because in a way I'm thinking about it now, it's actually very stupid to think that way. Yeah. Because, without your health, how are you able to take care of your kids? Exactly. Without your health, how are you able to get up every day to go to work? Without your health, how are you able to... Your health is the most important thing.
Yeah, no.
It's your temple. So I feel like when you prioritize your health, everything else comes after that. Yeah. But it's very strange that, from lower class backgrounds, most people tend to think that, I'm too busy, or I don't have the time to think about my health right now. But without your health, you're nothing.
Yeah. No, definitely.
And also sudden death is real. When I hear stories of people dying suddenly, and I'll think to myself, you looked so fit, I couldn't tell you had an health issue or there was a problem. That scares me to book the GP appointment, to be like, I got to make sure everything's under control, if you can get what I mean.
But then that's very mature.
Right.
Do you know what I mean? And I think when it comes to being mature with regards to your health, that's something that you have in check.
Yeah.
You don't see it as a sign of weakness, go into a health professional because of a fear that there might be something wrong, and getting, let's say, reassurance that everything's okay. A lot of people may feel that, but not be able to actually accept it. Yeah. So, like I said, for example, with my iron levels being quite low, there's a chance that could be something. It could be nothing, but it could be something very serious. And
give me an example of how, like, your iron being low could turn into something serious, because that's a common problem that a lot of people from where we're from in the UK lack iron. So, what's the worst that can happen?
So if your iron is deficient, let's say you're vegan and you don't eat red meat, chances are your iron will be low. Although lots of vegans will try to eat lots of green leafy vegetables, they'll take supplements. So it won't be to the level whereby they're very symptomatic. Black men don't necessarily tend to have low iron levels. Right. But let's say black women, if they have fibroids, it can increase the risk of iron deficiency, anemia.
Right.
So if your iron is low, you're thinking, what are the potential causes? It could be because you're not taking in enough iron, although that's unlikely. it could be because you have an ulcer in your stomach and you're not absorbing the iron. Or, worst case scenario, it could be that you have bowel cancer, and that could be a source of blood loss and a source of iron loss. So if your iron is low, you've got iron deficiency anemia, and the cause is unknown, usually they will do a camera test to look into your stomach and a camera test to look into your bowel as well. So that's the worst, that's like a potential worst case scenario.
Right.
But it could be just the fact that maybe, like I said, I give regular blood transfusions. My diet's not great. It could just be that.
You know what, going back to, just ignorance, I do understand why some people would avoid going for checkups because of the fear of, hearing I've got bowel cancer.
Yeah.
So some people just rather just live and not know than to go and sort it out, which is another stupid mentality.
The thing is, you're coming from a very mature perspective.
Yeah. So explain to me most of the scenarios you hear and see, being a doctor.
It's difficult to say because specialty I'm working in at the moment is very specific. Right. So at the moment I'm working in urology. Sometimes I work
What is urology?
So that's to do with, let's say, the system that drains urine. So kidneys, bladder, genitals, so penis. Right. But then I've also worked in liver transplant and other areas. And then I've done general medicine. Okay. But I think what you've touched on, this fear of what could possibly be wrong, and that being a deterrent to seeking medical advice, whereas like it makes sense to try to get rid of that anxiety in the first place, because either you have something and it needs to be treated, or you don't have anything. But the fear of the unknown is, let's say, that anxiety is it's difficult to empathize with, I would say. Yeah. Because obviously from your perspective it sounds simple, it's like it doesn't make sense. Yeah. But to an individual, it could be one of the biggest fears they have, that it could be on their mind most of the day. But they just don't want to hear that they've got something that they feel could maybe potentially be devastating. Yeah.
The thing with that though is that like from my experience, when because I've been on top of any problems that I've had, when I've gone to call the doctor to be that, I need to get this checked, I need to get that checked. Yeah. It kind of, one thing that I always hear is, oh, you look fit and healthy and young. Nothing wrong with you. Yeah. Do you know what I mean? So then it stops you from wanting to go back, because then you feel like you're not, what I feel like I'm not taken seriously. Okay. And then when something does happen, then it's like, it's kind of the stage is basically got worse. Okay. So it's like you want to go, but then at the same time, they're not going to take you seriously. So going back to what you're saying in terms of taking time off work. Okay, yeah, let's say you take time off work, but then you're not taken seriously. Now you're an inconvenience to your employer, which could cause you, if you keep doing that, it's probably going to cause you your job. Yeah. But that's you putting your health first. So then a lot of people probably take the sacrifice of not putting their health first because they're not going to get taken seriously. Do you know what I mean? And then obviously if they put their health first, then they're jeopardizing their job. So that's why a lot of people probably choose the job over getting checked.
Yeah. I've been there. So you just reminded me just now. So I definitely know what it's like to feel the pressures of your employer, just thinking you're always taking time out. Yeah. But
especially if you look
for health as well. Yeah. And then I also know what it's like to be seen by a doctor and not be taken seriously, or for them to just kind of dismiss your issues. The issue, if you get what I mean. So then you feel like, I just wasted my day. I felt like that so many times after getting a checkup. So yeah, I do understand how people can get into that way of thinking.
That's why, on top of that, that's why when I go to the doctors, I obviously let my mum know first what's going on.
Yeah.
But then one thing that she'll always tell me is that you've probably been told it as well, you have to exaggerate when you go to the doctors. Otherwise, they won't believe it. Sometimes you're just...
works.
I've been told that before I was a doctor.
All right,
you need
yeah.
to exaggerate to be taken
So
seriously.
come across like believe, like,
and sometimes we get patients who are clearly it's to say that they're exaggerating.
How do you measure if a patient's like exaggerating?
You can't really.
So you never know.
Really. But let's say sometimes you have patients who are, let's say, complaining of, let's say, intense abdominal pain because, let's say, they want an operation and they've had every form of pain relief and they're saying the pain is so bad, it's severe, the blood tests have come back, the blood tests are normal. Then you just go to put your hand on the tummy and they're like, so then what I tend to do is I use my stethoscope. So I put my stethoscope on the abdomen and I press down as I'm listening for the bowel sounds and they're completely pain-free. So whether they're exaggerating or not, you can't say, but it does happen.
But with that being said, so in that scenario, for example, do you as a doctor then take it serious?
No, you have to take it seriously. If someone is saying they're in pain, whether you feel their symptoms are not in keeping with, let's say, whatever the blood tests have shown, what the CT scan has shown, you can't say you're faking it because there's no objective measure of pain. But I wouldn't say it happens often that doctors will think, oh, this person's just exaggerating. Do you know what I mean? You're so busy, you've not really got the time to be questioning if someone's exaggerating their symptoms or not. You really take everything at face value, really.
Right.
So, like, with regards to that being a reason to avoid seeking medical help, I think, like, as long as, like, your symptom, what your concern is specific, then they should really take you seriously or be able to reassure you, and you should be content with however they've tried to reassure you.
What do I do if I feel like my doctor's not taking me seriously? I feel like I recall you telling me moments where you felt that way. What did you do?
That's the thing. The doctor's the only person that I can go to. Even like, for example, if I can't reach my doctor and I'll go to like A&E, for example. I remember one time I went to A&E and then the guy told me there's nothing he can do for me. I'm not bleeding. I'm not about to die. So
what happened if you don't?
So what happened was, as in with the issue.
Yeah.
I can't remember what the issue was. I was in some sort of pain.
Okay.
But basically, at the end of it, I just got given a piece of paper, and it said that I had to like call a number in the morning.
Okay.
And yeah, that was it.
And then you went on to see someone else?
Yeah, that was it. So I called the number, and then they just said that I need to speak to my GP. That was it.
Right.
But it was kind of like it was basically something like I could have just dealt with that myself by staying at home or even when you go A&E, you're there for like 2 hours or something.
Yeah.
So and then obviously that's another reason why people probably don't get their issues checked as well because of the wait times as well.
I think there's like doctors aren't always going to have the answers to every single problem that a patient may present with. Do you know what I mean? Sometimes.
Is it bad that we think that doctors have the answers to everything?
No, because that's the public perception. Do you know what I mean? If you have some, let's say, unusual symptom, you're not gonna think, oh, the doctor's not gonna know, so let me just deal with this. You at least want to go to the doctor, know that they've explored all the possible causes and have then come to the conclusion that maybe it's just a sprain, or maybe it's just this, or maybe it's just that. Do you know what I mean? As opposed to having that idea or thought from the start.
Yeah. Question: how much does diet affect our quality of life?
Quality of life. So in terms of short term or long term? Because long term, it obviously has significant effect in the sense of if you have a long term unhealthy diet, chances are you're going to have long term chronic health issues.
I would choose to focus on long term because I feel like when it comes to diet and the things we eat, you know, we create habits. We tend to warm up to the things that we like. So, like for example, I love sweets. I love sugar and chocolate.
Yeah.
So, the long term effects. What's the long term effects of the things that I like? For example. So, yeah, let's focus on long term.
So let's say long term diet, which is let's say unhealthy. So let's, like you said, chocolates, sweets, fatty foods, takeaways. It's obviously going to increase the risk of
The Uber Eats as well.
Yeah, because think of it, if you're just sitting on the couch ordering every single day, chances are you're going to be leaving your house less often. Like you're not even going to the supermarket to do grocery shopping. So the exercise you're doing is probably going to reduce. But there's a risk of, let's say, diabetes. There's a risk of having high cholesterol. And all of these things long term, they have quite disastrous effects. If we think of diabetes, so most people don't know the long-term effects of diabetes. They just see it as, oh, you're having sugar in your blood.
I still don't know.
Essentially with diabetes, the function of your pancreas, which helps to digest, releases enzymes to help to digest foods, and it also releases insulin, which helps your body utilize sugar. If your pancreas is not working properly and you have diabetes, you're going to have a higher level of sugar in your blood, which affects your blood vessels. And that effect has effects on your organs. So it has effects on your kidneys, which means you're going to have kidney disease. Your kidneys are needed for a number of things, to filter out toxins, to produce red blood cells. So that's one thing that's going to be affected. It affects your vision as well. It's a leading cause of like blindness in the developing world. It affects your blood vessels all over your body. So your legs, most people will end up needing it, well, not most people, but increases the risks of needing amputations, increased risk of strokes. So it's something that people just take lightly.
Why do we take these things lightly? That sounds scary. Everything Dr. Aleem just said is...
But it's ignorance. Ignorance is one thing. And it's that when we're young, there's that air of invincibility. Yeah. Because it's like probably growing up, you maybe knew one or two people that had a serious health condition when we were in school, when we were, let's say, in our early 20s. So you just think, oh, nothing's going to happen to me. I can just eat what I want. I can just do what I want. As you get older and you start seeing people who have these health conditions, then you may decide to educate yourself. But what happens if you don't see people who have diabetes or who have, let's say, end-stage renal disease, who have high blood pressure, XYZ, then you don't really, you just, it's like with for example. During the first wave, a lot of people said, oh, look, I don't know anyone who's had so it's a conspiracy. Whereas now, everyone knows someone who's had COVID. Yeah. Maybe, unfortunately, some people know people have died from COVID. So because of that, people just don't take it as seriously as they need to. And I would say with African Caribbeans as well, a lot of, let's say the average age in Africa, for example, it's not that high. So let's say it's 60s, 70s, or even younger than that. Wow. So we're not really seeing our family develop all of these complications of a poor lifestyle because they're not living that long anyway. Whereas now in the West, a lot of our parents will be living a lot longer and now suffering from these complications of a poor lifestyle. But it's not until they've now got it that we now think, okay, I need to change. And the thing is, change is good whenever you decide to apply it.
What are the some of the like main complications, health complications that you see within the African and Caribbean community?
So obviously it's difficult to say because like where I'm working now, specifically, let's say urology, which affects everyone. But let's say in urology, let's say prostate cancer tends to affect black men disproportionately to their counterparts. Yeah. And reason. Well, one reason could be because we seek medical intervention a lot later. We don't really know what symptoms to look out for. Because if I asked you what you would think the symptoms of prostate cancer are, you would...
Yeah.
I don't even know.
I would say something to do with, I don't know, when you go urine or something.
Yeah. So like your prostate is like a small walnut-sized structure that just sits beneath your bladder. And obviously we're young, so we're not at an age where it's likely to affect us. But in the say 40s, 50s, 60s, that's when we'll be at risk. And things like going to the toilet, seeing blood in your urine, or going to the toilet and struggling to pass urine. Let's say the stream is weaker. Things like that, people may not feel comfortable going to their GP about.
Totally understandable.
It's kind of, it does seem like it would be embarrassing, sort of, you know what I mean? And I feel like obviously, as that we're grown men, a lot of grown men, you probably don't want to feel like that embarrassment of, this isn't functioning properly or something like that. Do you know what I mean? Because it might make you feel like less of a man, especially when we're probably seem to be like we should be in our prime, basically.
Even amongst each other, like as men, we don't talk to each other about, like symptoms. A lot of times I think we'll just speak to our mother. Some men don't even have mothers to speak to. So it's like, then we turn to Google. And I think Google's the worst thing you can do. If you want to search any problem on Google, my God, that stuff.
Because then what people will do is they'll look at the worst case scenario. Yeah. And then they'll become like a hypochondriac.
Yeah. I never Google symptoms, because that stuff will just scare you.
Yeah.
Yeah, it's like you end up in a rabbit hole and then you'll see even Google where they will suggest another question related to that.
Yeah.
Then another one.
Exactly.
You know what I mean?
Okay, another common problem amongst black men is the lack of vitamin D3.
Yeah.
I remember one time I got a letter from my doctor after a checkup.
Yeah.
And they told me that, I was lacking vitamin D3. Yeah. And I thought I get all the sun in the world. Like, the moment the sun's outside.
Are you living in the same UK?
And I'm just like, okay, so I need to do more. So I started taking vitamin D3 tablets and whatnot. But, how bad is it? And what would you advise that I do to, or, us men do to, make sure we're getting our vitamin D3?
So I think like most African Caribbeans, people with a darker complexion in the UK are lacking in vitamin D because of poor exposure to sunlight. You need sunlight to initiate the process of the conversion to vitamin D. So because we have melanin in our skin, the melanocytes will absorb the UV rays, and that's going to affect the ability of that vitamin D production process occurring. Right. So the only way we can improve that is increasing our sunlight exposure or supplementing through, like, obviously most people take the vitamin D3 tablets, and that's probably the best thing to do.
Right. Now, from obviously your expertise, would you say the whole in terms of taking the supplements, in terms of like, because you were talking before about like lifestyle, so incorporating like a healthy meal, because some people substitute that with the tablets. Would you say that taking the tablets, if you don't have that, is a good substitute, or would you say that focusing mainly on the nutrition and what you're having for lunch and dinner?
Okay, so you mean can taken, let's say, multivitamins compensate for unhealthy
Yeah, is
diet.
it as beneficial, like in terms of what you're saying for like long term?
Yeah.
So with multivitamins, the evidence is there's like mix. It's a mixed picture. Some papers would say that multivitamins are very good and effective. Others would say that there's not much benefit. And ideally, most people should focus on having a healthy diet. And if you can afford to have a healthy diet, chances are you shouldn't be deficient in the majority of vitamins and minerals in those tablets. And then you need to also think, if you are deficient, then there may be a reason why, which would need investigation.
I think it's interesting that you said if you can afford to have a healthy diet.
Yeah.
Go into more detail about that.
So what I mean by that is it's more most people who can afford to have a healthy diet are maybe not lacking in the minerals and nutrients.
Right.
And if you think, let's say, how many people buy multivitamins? I think people who can afford to buy multivitamins probably also have healthy diet.
Right.
As opposed to someone's knows that they can't afford to eat healthy, so they're consciously compensating by taking the multivitamins and think, okay, this will suffice for now.
Yeah.
If that makes sense.
I mean, it can never be enough because I've always thought that, if I'm lacking vitamin D, I would go to Google and search what foods are high in vitamin D. Or like iron, for example. I was told that my iron levels are very low. And the first thing I did was bring up all the foods that are high in iron. So I feel like cashew, steak, eggs. I went to my local supermarket and bought everything. And I said, I'm taking that all in. So I don't think people link the food you consume with what your body needs.
Yeah. Because like what you're saying is you're being proactive. You're consciously trying to get all these multivitamins and nutrients from your diet, which is how it should be. You shouldn't be living off a diet of, let's say, just, I don't know, let's say burgers and chips every single day, and then thinking, I'm going to supplement with multivitamins. There should be an air of proactivity and having something that's balanced and having variety throughout the week. That's what I think, in my opinion.
I'm glad that you addressed that because I feel like a lot of men need to actually like be aware of that and, just realize how important your diet is and how, you do need to consume the foods that gives your body what it needs.
Yeah.
But I think one of the main problems is that when it comes to food, we tend to tend to eat what we like, what tastes nice.
Yeah.
I've always felt like, sometimes I eat some stuff like a boring salad with some olive oil. Yeah. And I'm like, this is boring as hell, but I've got to eat it because my body needs this stuff.
Yeah.
And I've got some friends that can't do that. Like they literally, if I don't see the point in eating that because I don't like it.
The thing is, there's a fine balance that you need to achieve. So let's say with me, for example, as much as I like jollof rice, you can't eat jollof rice every day of the week. Yeah. And I've actually started now having as opposed to having jollof rice with fried chicken, some days I'll have, let's say, quinoa with some sea bass or couscous with something.
Or bulgur wheat.
Exactly. But then, if we think of quality of life, if healthy food is so distasteful to you and it affects your quality of life, how can someone come and tell you, eat healthy? Do you know what I mean? Some people smoke knowing that smoking is bad for your health, but do you know what I mean? They can't live without smoking.
True.
So there's that balance between quality of life and doing what you enjoy, but not to the point that it's going to be detrimental to your health.
Yeah.
But then if you're consciously making the decision to do something that's detrimental to your health, no one can really say anything.
It's all a choice, isn't it? At the end of the day.
Choice.
Yeah, it's all a choice.
Yeah.
At the end of the day. You're gone.
No, I was just going to say that I think balance is the key word here. Like, the most important thing is having a balanced diet, you know, and making sure that you're consuming the stuff that your body needs. Like, sometimes I'll think, I've had loads of meals this week and I've not had any greens. And it will just hit me like that. I'll open my fridge and there's no greens. And I'm like, I've not had any greens all week.
So all
no
week,
fruits
all week. You have no week.
And I'll run to the supermarket and go and buy all the greens and, you know, and stuff my fridge with it. And I'll make sure that week I'm going to make up for the time that I didn't have it. But I think it's easy to forget and just indulge in, you know, just your pleasures, really. Just, you know, I'll hit up Wingstop and then the next day Chinese, you know, and because I like this and I've been working hard, so I'm going to treat myself.
And that's the
fun. Yeah, you think, why not? Like,
but then that's when it comes down to like being proactive and being health conscious. Because it's not just what you eat, it's, let's say, getting good sleep. Like, let's say sometimes
let's talk
sleep
about
like
that.
4 hours a day, 5 hours a day. It's some people, maybe they've been able to adapt to function with 5 hours sleep, but for others it's detrimental. A lot of people need 8 hours of sleep. Me personally, I need about 6 to 8 hours of sleep to feel good. Do you know what I mean? And then if we think about exercise, so the recommended amount of exercise is about, let's say, about 100 and 150 minutes of vigorous exercise, moderate to vigorous exercise each week. And strength training on top.
Right. 100 minutes.
So let's say 100 minutes of moderate intensity to vigorous intensity, aerobic.
That's reasonable.
And strength training as well. So that means, let's say, 2 sessions of, let's say, like cycling or Zumba or something, let's say football, tennis, something that really gets your heart rate going. And on top of that, some strength training. So maybe like, you know, squats, deadlifts, just some form of strength training activity, because that's good for bone health. How many people do that?
wait, is this what's recommended?
That's what's recommended.
Wow, I didn't know that.
So a lot of people who are like, being sedentary is a huge risk factor for chronic health conditions in later life. But most people do not eat, well, a lot of people don't eat well, they don't sleep well, they don't exercise, and the cumulative effects of all of those are possible obesity, diabetes, high blood pressure, all of these health conditions that mean you will have a possible lower quality of life in future.
That's the thing. So with me, for example, like, I don't know anyone that can hit all three, like in terms of like good diet, sleeping well, and exercise. Like if you take me, for example, I feel like I eat well, exercise, but it's the sleeping. And I think with a lot of young men, we feel like it's go time, like we need to make it happen, building a business or doing this, doing that. And there's this whole stigma of like, if you're sleeping, then you're not making it happen, someone else is making it happen. Do you know what I mean? So that's where...
If that's short term, it's probably okay.
But then short term habits can affect you long term. And I feel like with me, as I've got older, because from uni, I used to like stay up late, complete projects, and those habits have carried on to now. So now I'm editing late night. But then subconsciously I'm thinking, this is probably gonna ruin me later.
If it continues,
Like, the fact that thought is hitting your mind.
Yeah, but at the same time, it's hard to break habit, especially where I've got 2 kids now. I feel, for me, I feel like I need to make it happen.
So how much sleep do you get on an average night?
Average night, maybe like 5 hours.
5
like
hours.
Yesterday, I went to bed at like, it was 1:45 in the morning. Checked my phone. And I was like, you know what, I need to get sleep. But then my son's up at like 6:37, so then I'm up. And then when I'm up, I'm just used to like go mode. So I'm up, showered, ready for the day.
But would you say you feel comfortable? You feel refreshed when you wake up in the morning? You feel like your mental health is not affected by sleeping for 5 hours?
So when I wake up,
Yeah.
I know sometimes I'm ended. Like I'm like, I really need to sleep.
Yeah.
But at the same time, I'm like, I'm up now. Because the thing for me is that I live like, there's a shop across the road. And if they've got their stuff out the shop already, in my mind, I'm like, they've beat me. So I need to, you know what I mean?
Yeah.
So I think that's just something that I kind of obviously need to work on and think that long term, this is going to affect me.
Well, like, I think you also need to focus on the short term. And if you feel good with 5 hours of sleep at night, then if it's not broken...
Yeah, I feel like I can do it.
Do you know what I mean?
Yeah,
but
yeah.
I know personally, if I sleep 5 hours a night, I'm not going to function as well as if I get maybe 6 to 7 hours. Like, if I sleep for 5 hours, the first thought when I wake up is, I can't wait to go to sleep.
Oh, is it?
That's my first thought when I wake up.
See, I'm
The
different.
day's not even begun and I'm already thinking about bed.
All right. I feel like I've wasted time. It's crazy.
You might be too harsh on yourself.
Maybe.
Because a lot of the time, I feel like social media has conditioned us to adopt this. I think it's called toxic positivity. So it's like, you know, wake up 4 a.m. You know, if you want to be a millionaire, don't
5
sleep.
a.m. club
You know,
and-
while you're sleeping, someone else is out there taking all your opportunities.
Yeah.
And I love the message, but it's toxic to the point
sometimes
where
it's bad. Yeah.
it can
Yeah.
affect, you know, you basically start to neglect your body and you just adopt this mentality of, you know, I need to work, minimal sleep. You know, a lot of, I think Rick Ross has a lyric where he says, you know, that I'll sleep when I'm dead or something. Or Lil Wayne says that I'll sleep when I'm dead, you know, or sleep is the cousin of death. It's that type of culture that affects our mentalities, you know, so.
But the most important thing really is really developing a personal relationship with your own habits, not other people's habits. So because someone else is sleeping for 3 hours of sleep, don't feel you need to adopt their habit if it's going to have a negative impact on you. Yeah. And some people need 8 hours of sleep. Do you know what I mean? Some people say they even need 10 hours of sleep. So, but you need a sufficient amount of sleep so that you can function. So someone might function with 4 hours of sleep, and you can't really go and argue and say no, you need to sleep for 3 more hours.
Yeah.
What would you say is the link between stress and like sleep, and how much does stress actually impact our health?
So it's probably what we've been saying in terms of if when you wake up you don't feel refreshed, you're, let's say, still feeling very tired, you're still feeling sleepy, then chances are you'll feel more stressed during the day. And sometimes people don't sleep well because of health reasons, and that's something that needs more investigation. For example, if someone's depressed, one of the symptoms of depression is something called early morning awakening, where they'll wake up at 2 a.m. or 3 a.m. in the morning and be unable to get back to sleep. Obviously, then your day is going to be very difficult because, one, you're struggling with depression, and also you're struggling with not being able to sleep, not feeling refreshed, X, Y, Z. Then there are other health conditions that can affect your sleep as well. Stress is just really like, it has a negative impact on your mental health.
How bad would you say? Because I feel like when it comes to stress, it does ignite other health problems.
In what sense?
So I don't know, like I feel like when I'm stressed out, it actually causes pain in my body. I feel tense, you know. So I don't know. How important would you say it is? Like, what would you tell men? Like, I say, for example, some people are just literally just stressed out because of their finances. You know, the pressure. Maybe I don't know. They've borrowed money and they owe money and they just feel tense all the time. Don't these things then lead to other health problems at a later time because of how tense you are, how you feel from within?
I think with stress, the main issue is on your mental health, really. Right. And let's say resilience is something that affects people different. Everyone has a threshold of stress they can take. Yeah. So let's say it could be, university, exams, debt, XYZ. Someone can be coping with a lot. And if you hear what they're coping with, you'd be like, if that was me, I'd be mad stressed. But it affects people differently. And if what you're coping with goes past the threshold that you can actually maintain, then you may suffer from depression, anxiety, could possibly develop psychosis sometimes as well. There's something called stress-induced psychosis. So that could be because of the loss of a loved one, or anything that takes you past that threshold that you're able to maintain can have lots of devastating effects. Yeah. So it's important, obviously, as men. I think with mental health anyway, there's been a lot of positivity. There's been a lot of progress in terms of men being more comfortable. It's obviously a lot of work still needs to be done, but globally, men are more comfortable talking about stress and mental illness. But there's obviously still a long way to go to being more open to all the different aspects of mental illness.
Definitely. I feel like when it comes to like when your mental health isn't right, it does, for me, translate into physical problems, like complications, like just I feel like a bit of tension in my arm, or like I just don't feel right from within. Definitely.
Some people can be so stressed that they go blind.
Wow.
Seriously?
Yeah.
I've heard stuff like that before.
No. Oh. So it's like psychosomatic.
All right. What, as in
conversion. So it's the body's way of trying to cope with whatever's going on. Like I've seen patients who say they can't walk.
That's mad.
But there's nothing wrong with their legs.
Is that because they've got like the amount of stress is just depleted all energy?
So it's a very complicated or complex area of psychiatry, but it's something that can happen. They can have a physical issue, and you've done every single investigation under the sun. You can't explain it, and it might be linked to a mental illness.
This is why we can't stress.
Well, stress, the thing is,
can't stress.
it's about being comfortable. Do you know what I mean? It's like, if you're stressed, who do you go to? Because if you're stressed and you can't go to even your partner, or you can't go to your friend, or you can't go to, and you just contain it all within, then it's very unhealthy. Yeah. But if when you're stressed, you know you can go to someone and you're comfortable speaking to someone, then stress is not going to be as toxic, because you don't want to live a life where you're scared to engage with anything that might cause you stress because of what could possibly happen. You just need to have a healthier relationship with it.
Right. With I was just gonna say with that in terms of like expressing yourself. For me personally, I feel like as men, I feel like we need to get better with being able to express ourselves to our boys, and from our boys being accepting of that as well. Because I feel like a lot of us are kind of scared to open up, or we don't want to be a burden to them. Yeah. So we feel like we just need to contain it. Yeah. But yeah, I feel like as we progress, we need to be more accepting of that.
Yeah, definitely.
Most definitely. I feel like a lot of times people are scared. You think, oh, my friend wouldn't understand. But by you sharing your experiences, you could be educating your friend on that problem. So I think it's just about encouraging conversations, like the way we've, all got together today to just talk about men's health. But let's make this a thing. Let's talk about health, and, I think this has been a very good conversation.
Definitely.
I don't necessarily consume content like this where men get together, particularly black men get together and talk about our health. So I just want to say thank you very much, Dr. Aleem and Chris, for joining us on the Goodman Factory podcast. Thank you for listening. I hope you were able to pick up gems from this episode. From this point onwards, take the gems that Dr. Aleem has dropped on the episode and start these conversations with your friends, speak to your doctor, book a GP appointment. I would encourage these things. Is there anything else you would like to encourage our audience?
I would just say, just be more comfortable with your body, really, so that when something doesn't feel right, you can go to your GP, okay? Because if you're feeling fine, then I wouldn't necessarily say go to your GP. If you're feeling fine, but with NHS, they do checkups from the age of 40 every 5 years. But just get more comfortable with asking for help. If you have any health complaints, just be more comfortable.
Thank you very much for listening to the Goodman Factory podcast. Thank you, Dr. Aleem and Chris, for joining us. I hope you were able to pick up gems from this episode. Use discount code GPOD1 for 20% off Goodman Factory facial hair care and skincare products. That's www.goodmanfactory.com. Use GPOD1, GPOD1 for 20% discount code. Thank you very much for listening. Signing out.